Racked by pandemic fatigue, St. Lucians and the rest of the world appear determined to move on. Here at home, open-air social events and masquerade activities are now the rave. But Chief Medical Officer Dr. Sharon Belmar George, in her latest public health update, warns that the pernicious threat of COVID-19 and its attendant health effects are ever present. She implores citizens to take responsible and appropriate action with adherence to mitigation measures to safeguard their well-being, given the island's health profile and low vaccination rate.
As we continue to note the return to normalcy with the opening up of events and activities, we need to ensure that the proven public health protective measures are in place to protect us from getting sick and to protect the most vulnerable. The public is reminded that the threat of COVID-19, long COVID, and its complications still exists, especially given our below-average immunization rate in country. Personal responsibility is extremely important at this time to reduce transmission of infection to ourselves and our family. The public is guided to continue the use of face masks in public, ensure hand washing and proper general sanitization. The public is also advised to use their discretion, ensure they and their vulnerable family members are fully vaccinated and boosted before attending masquerade events.
The island has been grappling with the sixth wave of the COVID-19 pandemic, and the public health indicators are still high.
As of June 8, 2022, Saint Lucia has diagnosed a total of 26,250 cases of COVID-19 in country, with 492 active cases presently. The daily infection rate for the last 7 days is 28.3 per 100,000 population per day, with a 29% average testing positivity rate and a transmission rate of 1.3. We have noted a total of 370 COVID-19 deaths. We have 18 positive COVID-19 cases admitted at the Respiratory Hospital. 1 is critically ill and 2 are severely ill. This past week, we continue to register cases daily. We note increases in our public health indicators.
The rainy season is synonymous with vector-borne diseases like the mosquito-carrying dengue and the animal-driven leptospirosis.
The public is also reminded that as we commence the rainy season, this also corresponds to increases in vector-borne diseases such as dengue fever and leptospirosis. The Ministry of Health has intensified community and household visits, fogging operations, and public education. The public is reminded to inspect around their households and communities for mosquito and rodent breeding grounds. The use of mosquito nets is also advised. We already note some areas on the island with high mosquito indices at this point.
The Chief Medical Officer also addressed the global outbreak of monkeypox, which the authorities here are monitoring very closely. There are no reported cases in Saint Lucia thus far. Solange Alfred, HTS News Force.